So Jason, it's December of 2023. You are in year 3 of your early retirement, and I want to do a check-in with you about your utilization of healthcare. You've had a couple of good years, and I know this past year had some health challenges for you and your family. So I'd like to walk through the process that you use to, reevaluate the plan, because I think you've said in the past, well, I chose a certain metal tier and that's associated with a certain deductible and certain set of, health sort of insurance coverages, but I reevaluate that every year just based on current health. Maybe there's some health changes and your budget and those kind of things. So where are you at now?
Yeah, I mean, I guess I would say first, I feel very thankful that my family is very healthy on the whole. But we had this year, but let's just call it a perfect storm of different things go down, whether they be accidents or just healthcare needs or what have you. No kind of ongoing conditions, but just kind of all this stuff hit at once. And we have consistently been on a bronze tier, high deductible health care plan, and that makes us HSA eligible. But that also means that we're responsible for an awful lot of out-of-pocket expenses up until we hit that deductible. And unlike the 2 previous years where we didn't come anywhere near it, this year we went well beyond it. And so good news is for the rest of the month, we don't have to pay for any health care. But that's not necessarily a good thing, because it means we paid a lot for health care to date. Yeah. So this is the time of year where I reflect on that and kind of decide what to do for next year's healthcare plan. We have till the end of the month to lock that in, and just evaluating that made this a really good time to talk about this.
Let's paint the picture a little bit here for anyone who's new to the channel and doesn't know your particular situation. You're early retired in 2020. You have a spouse and a child. And so that's going to, obviously, we're focusing on U.S. healthcare system. So you're utilizing the ACA, the California exchange of the ACA, right?
That's right. Yep. Covered California is California's state exchange under the Affordable Care Act.
Okay. So your age is what? Are you comfortable sharing?
I like you, am 50 as of this year. Thank you, 2023.
Your wife is slightly younger, and your child is
17.
17. Okay. So all of these things will impact among other things, will impact what the ultimate premium tax credit will be on an annual basis. So you've been through this system now a couple of years. I remember us talking early on. You extended you chose Cobra coverage, right, for your first year, essentially, or 18 months?
Yeah, for the first portion, and that was largely due to deferred income, and also the fact that staying on Cobra meant that I had lower deductibles on a similar metal tier. So it just made sense to do that. But I've now had 3 years of the ACA, and I'm now electing for 2024 as well.
Okay, so let's talk a little bit about the metal tiers and the difference. Why choose bronze over another?
Yeah, and so there's some really good interactive calculators and some tools that guide you, either if you're in a state that uses the federal exchange or if you're in a state that has its own state-sponsored exchange, to help you decide based on how often you use healthcare, how they guide you. And obviously this isn't just about the past, it's about what do I think is going to happen next year. So It's a crystal ball question for sure, but the more data you have about previous years, and obviously the older you get, you understand more what your health is like, it guides you. And so it's basically like, do you have ongoing prescriptions? How often do you need to go see the doctor? Do you have any ongoing other care needs that you're aware of or that you're concerned about? And then you basically decide, do I want to pay a high premium and pay much more, less out of pocket, have assuredness that maybe high value things are going to be taken care of? Or on the other extreme, are we rather healthy and we're very low burden on the healthcare system, and then we pay a much lower premium, maybe even nothing, but if things do happen, you're going to pay more into it before the insurance starts helping you or covers the whole thing. And then there's somewhere in the middle as well where you're going to use it somewhat. So maybe you have co-pays, small amounts you pay every single time you access service, but your deductible is also lower. And so that's the process I go through every year, is just look at what we spent, have a brief conversation with Lori, my wife, about what are we thinking for next year based on what we've seen, and then we just go ahead and do it. So that assessment part doesn't take very long because there's not really big changes at this stage year to year, and we have all the data about what healthcare we actually undertook because we have an HSA, and that means I have a nice, simple electronic record of all the care we got.
So having the HSA naturally is paired with your high deductible healthcare plan, right? So
That's right.
if you're comfortable
Yep.
sharing, what are the costs here? Because
Yeah.
I remember initially you chose the bronze plan because you said, well, we're fairly healthy. I think
Yeah.
we have rather low utilization of healthcare, and I'm willing to take the bet that, maybe every 2 out of 10 years or 3 out of 10 years might, the spend might go above what I would expect to pay.
That's right.
So you kind of rolled the dice. It worked out for 2 years. The last year it did not.
Yes, that's right. And I guess the first thing for people to know, for those maybe newer to the topic, and obviously, Eric, we've talked about healthcare twice before. I'll link those episodes in the show notes. But many people on ACA are relying on or hopeful for, sometimes they're called subsidies, but they're actually called federal advance premium tax credits. And basically, that's an offsetting all the way up to, the full cost of your healthcare that comes as a result of calculations involving what your income is going to be for the year. And so the first step I do every year and happens in everyone who uses an exchange, no matter what it is estimating your next year's income. And that's everything. So it could be fund jobs for many retirees, especially early, who can't touch retirement assets. That's the gains and the taxes on those capital gains that come from selling assets, or of course you have dividends. And then if you do Roth conversion, so all these things that result in income determine your MAGI, or your modified adjusted gross income. And there are different types of MAGI. This isn't meant to be a deep dive on that, but there's a lot of information out there. Anyway, you have to estimate your income. That determines your tax credit, and you're shown that up front in the process. And then the next step is, let's go shop for plans. And so
Can I pause there for a second?
Yeah, please.
Because the income part of this, there's a lot of nuance to this. And if you're further away from reaching financial independence and retiring early, you may not pay attention to all the details, but there's kind of, you really have to think hard about how you realize income in retirement if you're planning on taking advantage of these premium tax credits. And
True.
One of the things that I think isn't fully appreciated is the benefits of having a taxable brokerage account, because this allows you to realize income. But in reality, if you're buying something, the return of principal, if you're selling assets in your taxable brokerage account and you have a certain amount of basis in those shares, return of principal does not count toward MAGI, right?
That's right.
So
it's just the gains.
So I think a lot of people will look at this and say, well, gee, Jason qualifies for all these premium tax credits, and yet he's living this like large life in California. And how do I square those two things? And part of the magic of that is that you do have a taxable brokerage account, which has a fair amount of basis in it, I have to imagine, right?
For sure. But also something to think about is, depending upon the year and circumstances that are largely out of your control, if you're being a disciplined investor, is you're rebalancing, and that means you're selling things to generate income. And it's not necessarily a good thing when you're selling everything at a loss, which of course a year ago was the case, right? As you mentioned, I remember you asked me, you're like, so you're selling bonds, right? And I said, absolutely, I'm selling bonds. And I was selling those bonds at a loss because equities were way down and bonds were down too, but they were down less. So I was selling things at a loss. So I didn't generate nearly as much gains that year. Whereas this year, it's a mixed bag, but on the whole, up. And so I am generating gains. And so, yeah, that's out of a taxable account. So I have to think about that. And, that math, I actually look at it throughout the year, maybe a little more granularly than I need to at this point, but I just monthly go in and do a quick update. I'm probably going to move this to quarterly next year, where I just look at, and I just grab it out of my brokerage account. What are my total gains, my dividends, et cetera. And then I have my interest that comes from my banking, right? And then my, any hobby income or our fund jobs, anything like that all goes in. And then I can just see as I go throughout the year. And that's one way people identify, like, oh, maybe I have more room to do Roth conversions this year, for example. But of course, now that's income too. On the other hand, if you are somebody that chooses to contribute to an HSA, or you're still eligible to make Roth contributions or solo 401k contributions, and things that may affect, that may become deductible. Well, that also matters. And one of the nice things about, at least I can only speak for, and I should make this clear, I can only speak for what the covered California workflow looks like. Everybody has to follow the same rules, but that doesn't mean the sign up form is as user friendly everywhere. It differs, is what I'm told. But in California, they do guide you. Like they ask you, are you going to make Roth contributions? Are you using an HSA? And so you just plop that in there, and then it just tells you, well, based on that, this is what you're saying your income is next year. Is that right?
So you're attesting to a certain income figure. You're not. Yeah. Okay.
You are. And there's actually, and this is what's unclear to me. Probably somebody from California will respond in the comments. But in the first and second year I signed up, I had to either supply objective evidence, which was, pay stubs and things like that, or there was and I called and asked about this because I said, I don't have everything, because some of this is new and I don't, and they were like, oh, no problem. Here's a link. You just download this income attestation form and you just attest, like, this is what I think my income is going to be. And it doesn't matter if you're a little wrong at the end of the year. If you you have more subsidy than you're eligible for, it gets, it gets reconciled in your tax return. If you had, your income was even lower, you could be eligible for even more benefit. The only thing they tell you is if it changes dramatically, you should let them know, because then they'll change the way that your premium is charged out. But so it does guide you.
Okay. Because the income component of this, to me, is kind of the most complex part.
Yeah. I stressed out the first year. And as a business owner, I can imagine it's only going to be more so.
Yeah. And I think, I've done further research since we've done 2 previous episodes on healthcare, and I've done a bunch of research in the interim, seeing my FI number approach on the horizon. And then I have a lot of better information now. So the resolution on that is much better for me, but I don't want to focus on that for this particular discussion, but I do feel like it's not always appreciated, that taxable brokerage account, the value of it to securing some of these premium tax credits, and also just thinking about, your basis in it, and also long-term capital gains rates are different, and that has a magi component to it as well, right? And I don't know if you're thinking about, I imagine you've spreadsheeted this whole thing out so that
I do.
You've got your cells all red and green for hitting things or not hitting things.
Yeah, it gives me confidence, honestly. I think, some people in the FIRE community are total spreadsheet jockeys. There's a few that follow us, and I see their comments and I see what they post on Reddit, and it's really some beautiful work. Most people don't do that. I think I trend towards like the average to above average. I'm not a master of this stuff, but I do have little notes in there about, this is the 0% capital gain ceiling. This is the, all these kind of teasers, just so I'm aware of it, because, a lot of people talk about, well, you're not going to have to pay any tax on the capital gains because you're below the limit. And that is true for me at the present, but it doesn't mean that doesn't affect the ACA subsidy. So you do have to think about it if you plan to or are investigating going on ACA.
Well, I know this is a huge sidebar, but I had one more question about the income. So when you're selling lots in your taxable brokerage account, are you selling based on specific ID or, highest in, first out kind of?
Yeah, I do have everything in the taxable in particular account set to specific lot. And that just allows me to, maximize, or at least to make choices based upon basis.
Right. You want to make those choices, right?
That's right.
And I think when you make that decision, I think it's sticky for at least a while. As I
recall. That's right. They do notify you of that when you elect it first. I did it some years back, so I don't actually remember how it says it, but I remember being prompted.
Okay, so the first step in the whole process is to kind of estimate what you think your income is going to be for the following year. What's the next step?
Next step is you'll get that kind of answer. What is your monthly premium tax credit going to look like? And so now you have that number, and then the next step is go look at the plans. And at least in my exchange, and I have to believe this is probably the case everywhere, they show you each of the plans, but contemplating that tax credit that they've now told you qualify for. And so while they show you in smaller font, for example, the actual cost of this plan might be, let's call it $2,000. They'll say, oh, well, you have a tax credit of $1,000. And then the big number is it would cost you $1,000.
Okay.
Right. That would be more like a gold plan or maybe a platinum plan in some states.
Yep.
But yeah, so you go look at the plans, and there's a lot of in my view, I can choose by provider. There's two major providers on the exchange in California. Metal tier, you can choose HMO or PPO. And I feel like there's one more category. Oh, yeah, HSA eligible. And so you can just kind of filter that down. And typically I'm evaluating silver and bronze plans. So the first two levels, gold, and then sometimes I think there's still platinum, unless that's just like a commercial healthcare thing. But so I don't look at those top plans because they're much more expensive. But just for sake of example, a bronze plan might show that the monthly premium would be zero or very low, and then the silver plan might show a few $100s. And then so you will look at those, and I don't just look at that monthly cost for the premium, because that brings me to the next step. What are the coverages? What are the when does coinsurance kick in, if it does, and what do your copays look like on a silver plan? And then what is your out-of-pocket maximum for yourself and then for your family? And, are your doctors in plan for both providers? If you have existing doctors you've been using for commercial insurance, this was big in year one. And then I just look at those side by side. I go back to my HSA spreadsheet and I make usually it's a hand wavy quick check. The first 2 years I said, yep, we didn't use a lot of healthcare. The first year my out-of-pocket was $3,500. The second year it was $1,400, and that was against a possible max, of like, let's say it's 13, 14,000 depending on the year. So I was way under the limit. So it's a really quick exercise. This year, not the case. So I actually went in and actually made a small model of, had I had silver this year, based on what I'm seeing in front of me, this is what it would have cost for my premiums, if it's a few $100s a month, plus making estimates about co-pays and things like that. And then I just look at that, compare it to the bronze plan, which I know really well. And then I just have to make a decision. I literally just click a button and say, I want the silver plan or I want the bronze plan, with or without the HSA eligibility.
Got it.
That's the process.
Okay. And so what are you going to share your premiums? What were they?
Yeah. So what I would say is, without kind of being specific, to date, bronze plans were usually very low to no cost per month. And then silver plans were usually a few $100s a month, I would say, after the premium tax credit. So I am eligible for a pretty decent tax credit. We keep our income pretty low so far. If the market goes wild and things change a lot, well, then my income may change, because I may be, having more gains, right, versus that basis. Good problem to have. But right now, I'm eligible for, pretty reasonable credits. Some people in our audience often ask about and talk about cost sharing reductions and, silver, the different types of silver CSR plans that are available. And those are, if your income is, I believe it's below 250% of the federal poverty limit, the FPL, but above wherever the Medicare cutoff is. If you're in that window, there's different levels of cost sharing reductions that are available, up to and including no deductibles at all. And so many people take advantage of those, especially in the lean fire community, but I'm not eligible for those based on my family's income and our family size. If we had more children or we had a lower income, then that would be different. And certainly people, living in a lower cost of living area might have, this might be a more common option. So certainly something to look into, but not something I have to add to that complexity. I would have to either reduce our income, which would then mean changing our budget literally. So not something that we're looking at. It's
important to look at the total cost too.
Yes.
Right? It's like
total cost of care.
It's not only your premiums, the meeting deductibles, it's the cost of eye care. If you have that as an issue, cost of prescription drugs, any other out of network costs. So there's a lot to figure in there. So did you add those into your calculations?
Yeah. So, good question. For us, the optical and dental benefits that are available on ACA aren't worth it. We've done that math in the past. The good news is that ACA does cover things like routine dental and eye care and basic glasses for children. on ACA, and so we've been able to take advantage of that for recent years. Once the teen becomes a legal adult, I think that goes away. I think it goes away at 18, if I'm not mistaken, but I will obviously be looking into that soon. But to date, that's been good. So in the numbers I gave about our healthcare costs, vision and dental are not included, because while those things are HSA eligible, which is good, I can keep records of those and someday take out of the HSA account based on that. They don't actually, go towards this spending for the affordable healthcare plan that I have.
Got it.
So those are even higher because, we have multiple people with glasses, and I unfortunately needed a lot of dental care this year, which is one of the things that drove my spending through the roof, but doesn't actually help me hit my medical deductible. So, you're absolutely right. You do need to contemplate those, and they may make good sense for you.
Dude, there's all those gold teeth you got. Show us the gold teeth.
I have 0 gold teeth, but I do unfortunately have quite a few crowns, and now as of this year, a dental implant.
No silver amalgam fillings in there?
No, they're all gone. They started to degrade and produce more opportunities for cavities years ago. So those have been replaced.
Oh, darn. Okay. I was hoping for a good thumbnail of you showing your new grill.
No, I only, at this point, I only have composite crowns. And so they look just a little better than my regular teeth, I guess. Sorry, I have no grill.
Hey, I did want to ask you about this. It struck me that, thinking about income and having to realize, appreciated stock sale and things like that. Does this make a case for not carrying a mortgage into early retirement? You're going to have to realize some income somehow to pay for that mortgage. Have you done the math on that at all?
No, I haven't done that math. I usually think about the mortgage in terms of the interest rate versus thankfully the very low interest rate I still have versus the potential income generation cost of keeping money in the portfolio. I haven't layered in the income generation required to pay the mortgage. So good question. I haven't done the math.
Well, it also tells me you're not close to the cutoff then. Because, if you are, you start thinking about those things. It's like, how do I realize income in the most tax efficient way? And
yeah, for sure. I mean, I'll be candid, Eric. All these things are good problems to have, but it doesn't mean that I like thinking about this stuff.
Yeah.
Arguably, while this system provides a lot of benefit to a lot of people, particularly having nothing to do with retirement, right? Just people who are able to now access healthcare at more affordable prices. And please don't turn this into a political conversation in the comments. I'm not interested. However, for retirees of any stripe, this is complex. And to think about this and have to do this math in order to appropriately be able to leverage this and just use this system, there is a lot to know. And that has created an industry where there are, people out there, that are available for a fee to help people pick plans. I've never used a healthcare insurance broker, but I know people who were on the fence about do I go private? Do I use ACA? I have some complicating factors. That's always an option out there. But I mean, arguably, this stuff isn't simple.
Yeah. I wonder if you're a spreadsheet guy. Have you done much modeling when it just becomes you and Lori and your kid drops off the plan? And as you get older, we have this gap between now and when, well, I guess the full age for us is going to be 67 when Medicare kicks in now, right?
If you say so, I don't actually remember.
I think people
I just
born
keep
after,
thinking it's 65 and it's far, but is it 67 now?
I think anyone born after 1960, they raised it to 67. So in the past, we've said 65, but there's this gap, right, between your age now and then. And obviously premiums are going to go up. We don't know by how much. And then some of this, premium tax credit's going to go away. Is this just something you're going to reevaluate on a year by year basis and not something you're going to plan for long term? Or have you done any of that kind of modeling?
Yeah, I have to admit, I've done fairly minimal modeling on this. I've done things like stick in some extra money after a certain year and then increase it again in my cash flows section of the safe withdrawal rate spreadsheet. This is pretty similar to what Karsten puts in the example. And I mean, honestly, I feel like it's better than nothing, but it's not great. Yeah. The good news is, for doing this kind of modeling of, co-pays and, what kind of co-insurance costs, it's not trivial, but it's not hard, because I did a quick run through of it this year just to make sure I was still, of the mindset that, sticking with bronze is right versus going to silver. And honestly, I just want to have something to show Lori, because she's not going to do the spreadsheet, to say, this is what I'm thinking we should do. Do you agree? And it was a really good discussion, honestly, because I was starting to lean towards like, well, maybe let's be more risk averse and go for a silver plan. She was like, well, hold on now. Like, in all honesty, based on these things, which are kind of one-time events, like, it seems to me, based on your model, we should just stick with bronze. And so that's where we are right now. I mean, we could change that in the next couple of weeks still if we want. But so I imagine doing something like that, especially as our healthcare situation starts to change and it's just the two of us. If we have any more chronic issues, I think we're certainly going to have to do that. But so far, I've been taking it kind of year to year, because we literally don't have to do anything different outside of enrollment period unless you have some kind of life-changing event, just like people are used to with their insurance through their employer, right? If you get married or have a kid or whatever, you become eligible to enroll again. So besides that, it's just something I got to think about once a year.
So you did you had a bad year last year, and I presume you plugged those numbers into your budget. How did it affect your overall budget? Like, difference between a sort of good year, an easy year, moderate year, and a bad year?
Yeah. So I think the good news story is that while by default, our budget is set up to under withdraw, by having this additional medical expense largely, and then a couple of other one-time expenses, we came much closer to our maximum, our ceiling, if you will, on the CAPE model than I used to feel comfortable doing. I was surprised that it didn't scare me as time went on that I was just coming close to that ceiling, because I know that there's still some conservatism built in there, right? It assumes I'm going to live to 220, not really, but it assumes I'm going to live a long time, and that our spending isn't going to go down when we get much older. And so I was starting to get really nervous in the first 6 months of the year as we started to withdraw more often above our limit. But when I look at it in context of our ceiling, while we're the closest we've ever been to it, it's actually okay. So I think that idea that I've pitched before of like, under withdrawing because it gives me confidence when we have to go over, like, there's some merit to it. But I'm not going to lie and say I wasn't nervous. I was getting pretty concerned about how much, like, bam, $4,000 for a dental implant. Like, that's all out of pocket. That's big. And for many people, that could be huge.
Yeah. I was going to say, I was wondering how it affected percentage wise. Like, it changed my budget percentage by this or something, it was like not.
Well, honestly, Eric, the thing I started doing that I initially thought was just kind of over tracking turned out to make me feel really good at the end of the year. It's pretty artificial to think about budget on a monthly basis, right? It's just a period we've agreed to track as a budget. And so while I was going way over a couple months, I was under other months, but I kept a running total of where I was for the year. I mean, it's a spreadsheet, right? It does that automatically. And at the end of the year, I was below the maximum for the year. So, that having that little tracking tool in there at the end of the year was like, well, yeah, this is fine. But month to month, I was totally freaking out, because in the month with the dental, to answer your question, I mean, that's like, you're talking about like half the budget, or, something under half the budget or whatever. But it was a lot percentage wise. And thankfully that didn't happen every month, but these things can happen, right? Life isn't certain. And that's where the idea of sinking funds comes in, and, conservatism and budgeting.
It kind of makes a case for your cash buffer a little bit, doesn't it? Because
that's fair.
And especially when we're talking about realizing income and maybe wanting to defer some realization of, selling stuff in your taxable brokerage, so you don't have to, exceed a federal poverty limit. There's lots of reasons for having a cash buffer, but this kind of bolsters the case for having one, I think, when you're starting to really utilize ACA subsidies.
Yeah, you're right. That's a really good way to look at it. Thanks for pointing it out. And people differ on this, right? We get comments all the time, and many bloggers have written about this, like why I don't keep an emergency fund. Carson's one of them. Not that he doesn't have a cash allocation, because he pretty clearly told us he did when we spoke to him on Two Sides of Five. But That's right. It does serve a lot of purposes. It's not just mental comfort, which is what a lot of people talk about, including me. But yeah, it is. And I kept 2 years of cash buffer for the first 2 years. And I've decided for 2024, I'm actually going to bring that down to 18 months. And I think that's okay. I still don't want to have to sell when I don't want to sell, except to do my rebalancing. But yeah, I guess I feel a little more comfortable than I did previously.
Okay, so you're going ahead with the bronze plan, right?
I think so. I think I'd say it's better than 80% likely. We're not going to change it. I think we're probably done talking about it. I'm not going to give you 100% just because, I don't know, Lori's visiting her folks. People talk about their health when families are together. Maybe she'll come back and be like, you know what? Let's be a little more conservative. We'll pay a little more out of pocket. But honestly, I was pretty happy that she used the financial argument to justify staying on bronze. She was like, no, look at the numbers. She's like, we should stay on bronze. I'm like, all right.
I thought you were going to say you took her bike out back and smashed it to pieces.
No, I mean, the bike was one source of healthcare spending this year, but it turns out the bike is more durable than the human body. So bikes don't get hurt as much in accidents as the people do.
Exactly. Keep her away.
Thankfully, she's fine now, in case anyone is worried.
No, nobody's worried about that, man. We cared more about the bike. Come on.
I mean, it's a pretty nice bike. Does anyone want to buy it? We've talked about healthcare for the entirety of the, more than 3 years now, 3.5 years that I've been retired. But I've had a little bit of a shock to the system this year.
Yep.
I'm still standing, but this is more information for you about what could happen once you start using this healthcare system. Sure. I know your situation is different with the business, but where does it find you thinking high level?
I mean, it's great to have this information. I feel pretty naive going back and listening to those earlier healthcare episodes. I was completely in the dark about it. And so over these past couple of years, I have learned a lot, not only from you, but also from Amy, and seeing your experience is helpful because at some point we're going to be utilizing this system. At present, the plan is to have the business take over the health insurance. And so that becomes a business expense. And there's kind of technical ways of managing that. But, just in terms of budgeting for it, it's a big expense either way. If I didn't have the business, it's definitely was in the budget and the original fine number for a certain amount of money. And it's helpful to see how you've managed both the good years and the years that are challenging, because they're inevitable, right? It's going to
totally
come. And so to have a plan for it is the right thing. And then to just reevaluate. It's helpful to see your process and hear about that. And I'm glad that your family has weathered the storm, so to speak. Who knows what's around the corner, but that's why you have insurance, right?
It's why we have insurance, because there's going to be fishing accidents, biking accidents, and whatever else. And we had all those and more this year. So there you have it.
All right. So is this what's scaring you off from biking around Iceland, or is it something else?
No, it's not that at all. I just don't love road cycling. It's not my thing. Mountain biking is much more interesting.
Well, I mean, it's not like road cycling.
Well, it's still roads and there's cars and no one gives cars room and
Black sand
all the
beaches.
usual.
Come on, man.
I've been to the Black Sand Beach. It's cool. I would like to go there again.
All right. Well, we'll try and keep it healthy.
Let's keep it healthy. And, to be clear, and just kind of as a reminder, there's so much good information out there on this topic. I'm going to link a lot of stuff in the show notes that I have found from people who have really done the math on these things. And I've used some of those resources too. So don't forget to check out twosidesoffi.com. That's where you're going to find the show notes for this. So
if you made it to the end,
yes,
you must leave a review.
That's it.
Our reviews are not moving at all. We have all these people emailing us and leaving comments. We love your show. Love your show.
They do.
But they haven't left a review. It's very easy. Tap that star button on your podcast app of choice, and actually a written review just saying how amazing this show is super helpful. So we appreciate you.
Yeah, we totally appreciate you. Thank you, everyone, for supporting us, and be healthy.